All right. Thank you all very much for joining us today as we talk about fibroid treatment options and a new treatment option that is available for women, which is an incisionless treatment option called the Sonata Treatment. My name is Tara Murphy. I'm with a company called Gynesonics that has the product of the Sonata Treatment. And we are lucky enough to be joined today by Dr. Wendy McDonald to have a conversation with you, answer any questions, and talk to you about what all of your different fibroid treatments are, and then go into a little bit more detail about what the Sonata Treatment is. Dr. Wendy McDonald is a board-certified obstetrician gynecologist and a published author. Known in the media as Dr. Every Woman, Dr. McDonald shares evidence-based health information to educate the masses and inspire future physicians through music and literature in fun and innovative ways. Dr. Wendy is a graduate of Northwestern University, Feinberg School of Medicine, and practices full-time obstetrics and gynecology in downtown Chicago at Women's Health Consulting, and is a contributing faculty member at Northwestern Prentice Women's Hospital. We will put her website in the chat so that you could learn more about her at the end of the webinar. And I'm going to turn it over to you, Dr. McDonald, to get started talking about a new treatment option for fibroids.
Thank you so much for that kind introduction that I wrote. Just kidding. But no, seriously, I appreciate it.
Impressive. It's impressive.
And thank you guys all for being here and, kind of desiring to learn more about fibroids. Also, if you do have any questions, I know you said this already, but just reiterating, please feel free to put them in the chat. We'll be answering questions. I'll be answering questions throughout the webinar, so we'll keep it interactive and engaging. So let's talk a little bit about fibroids. I feel like we can go to our first slide. And so this is a short video, but it's 7 women who talk about their fibroid journey and their stories. And I think that it just is going to hopefully highlight what experiences, kind of the depth and breadth of what people's experiences can be with fibroids.
Most fibroids are asymptomatic or without symptoms. For the women that do have symptoms, the symptoms are heavy menstrual bleeding, low pelvic pressure. You could have problems with urination, constipation.
I first started having symptoms about 7, 8 years ago.
In my early 20s.
Probably 8+ years ago.
4 years ago.
When I first started my cycle at age 14, and they were always horrible.
And some of the stories that women have communicated to me have been otherworldly. They really modify their whole lifestyle as a result of their symptoms.
My symptoms got so bad that I actually had to change careers because I could not continue taking days off of work because I couldn't get out of bed.
My symptoms were so bad to the point I will be in the house a week straight.
It was essentially having my period all month long.
When I was taking sick days because I just couldn't get out of bed, painkillers were not helping.
I don't remember a time when fibroids didn't affect me.
My doctors told me that the best treatment would be most likely a full hysterectomy to treat this.
They offered me birth control pills to help with the bleeding.
I went to several doctors looking for an alternate opinion, and I consistently got hysterectomy being my only option.
Hysterectomy or myomectomy, I believe, is the other option she gave me.
A hysterectomy was my only option.
A hysterectomy. And then they suggested I could take some birth control pills.
Minimally invasive hysterectomy, your recovery is 3 to 4 weeks. If it's done open, it's a 6 to 8 week recovery.
I thought a better option would just be to deal with the symptoms than to have my body parts removed.
There were not any treatments for it.
The Sonata treatment is for women with symptomatic fibroids who want to preserve their uterus and avoid major surgery.
After my Sonata treatment, I saw relief. I wasn't having constant periods every single day.
It just started getting lighter and lighter.
I say about a 75% reduction from what I was used to.
I do not suffer from the pain, the cramping, or the heavy bleeding like I did prior to the Sonata treatment.
I don't have to worry about going anywhere when I'm have my period. I don't have to worry about if it's going to be an incident like before.
The procedure takes less than an hour typically. Recovery is a half hour to 45 minutes before you're discharged and ready to go home.
I no longer have to carry an extra change of clothes. I don't have to keep anything on my mattress.
You have a chance to actually have this treatment and know that your life can be so much better.
Absolutely, hands down. Investigate it, check it out. I would look at it as a first option.
I know this sounds weird, but I can wear white pants and not be nervous about it.
I would definitely tell them to try the Sonata.
The Sonata treatment is very effective. 95% of the women have a reduction in menstrual flow after 1 year, and 97% would recommend it to a friend.
Look into the Sonata process.
Just give it a chance.
It's a game changer.
I never got to wear tampons before. I can wear tampons now.
I believe it's the way to go.
Oh, yep, Dr. McDonald.
Unmuted, got it. So let's go to the next slide.
Yeah.
So let's talk a little bit about what fibroids are. This webinar is going to focus on really like explaining that pathology, but then of course also the treatments as well. So let's start kind of at the bread and butter. We can go to the next slide. So fibroids are basically fibrous growths within the uterus. Typically they're benign, so not cancerous, but they can cause symptoms. They don't always cause symptoms, but they certainly can. They can cause heavy bleeding, they can cause pressure. Another term, or the technical term for fibroids, is myomas. So that's where the term myomectomy comes from. My light is all weird today, guys. I turned my lights on, forgive me. But that's where the term myomectomy comes from, because fibroids are myomas by, the medical definition, but they typically can exist in various places throughout the uterus. So they can be in the walls of the uterus, they can be in the cavity of the uterus, they can be kind of toward the external component of the uterus. And where they are also can dictate how they behave and what kind of symptoms they cause. Let's go to the next slide. So symptoms, so basically back to kind of where they are. Submucosal fibroids or submucous fibroids are typically the ones that are inside of the cavity of the uterus. So I think about the uterus almost like a pear. And think about fibroids that are in the cavity of the uterus like the seeds in a pear. They will be the ones that have the closest access to the exit point of the cervix and cause heavy bleeding. So submucosal fibroids are typically the ones that are going to cause heavy bleeding. Intramural fibroids are the ones that are in the wall of the uterus, and they can cause pressure. They can even cause some pain. They're not always the ones that also are going to contribute to heavy bleeding, but they can. And then subserosal fibroids or subserous fibroids are the ones that are more on the periphery, like what you would be able to see on an outside of a fruit. And they are the ones that can cause pressure on the bladder, pressure on the bowels, bloating, discomfort, constipation. And so where they are and how big they are can impact what they do. The bigger subserosal fibroids or intramural fibroids are often the ones that are going to cause what we call mass effect because they're big. The submucosal fibroids can be little. They can be a centimeter, in size and cause heavy bleeding. And that is, going to be enough for a person to necessarily, even to possibly need treatment. So, size doesn't always matter. Location matters probably more than anything. but size can be a big player when it comes to fibroid symptoms. And they can affect intimacy. They can make you cancel events. They can make you, bleed for long periods of time. I always tell people my red flag, and I say no pun intended with that, but my red flag is when you're messing up clothes. Like if you're messing up clothes or sheets and we're like adults, you're not a teenager just learning about your period. You're skilled enough to know how to handle your period. And if you're still messing up clothes or sheets, you're probably bleeding too much because it's gotten out of hand at that point. We can go to the next slide. And again, you guys ask any questions in the chat if you'd like. We can stop in between. And so in the US, nearly 70% of Caucasian women and up to 80% or more than 80% of African American women or women of African descent have fibroids by the time they turn 50. And that just means they are really ubiquitous in the population. Now, everybody with fibroids does not necessarily need treatment, though. So obviously, that's a large population. But just because a person has them does not mean they have to be treated or removed. But we go back to that conversation of symptomatic fibroids. They're causing symptoms, then we have to deal with them. But they are very common to have. 20 to 50% of women will have some sort of symptom. And then each year, more than 2 million women undergo some sort of treatment for uterine fibroids. If you have family members that have had fibroids, you're at increased risk for developing them. I also come from a generation where a lot of the older women in my family and that I know had hysterectomies. Like for the longest, hysterectomy was kind of like the one-stop shop for fibroids or for heavy bleeding. Heavy bleeding, fibroids. Hysterectomy. Fibroids, hysterectomy. Your tooth hurts, hysterectomy. You know what I mean? Like everybody got a hysterectomy. Nowadays, we have a very wide and broad kind of like, depth and breadth of treatment options, which is why we're going to get into one of them, which is Sonata, but a few others as well, because not everybody needs that major surgery. Not everybody needs to have their uterus removed. Some people do. Don't get me wrong. Hysterectomy still has its place, but it is not the sole, option for management of these symptoms. You can go to the next slide.
And Dr. McDonald, we do have a question in the chat.
Okay.
So this question reads, is the Sonata treatment widely practiced among doctors?
So it is a practice that is gaining popularity amongst obstetrician gynecologists and amongst MIGS doctors. MIGS is minimally invasive gynecologic surgeons. And so there's going to be a link at the end where you can find a Sonata provider near you, but not every provider does Sonata. I've only been doing radiofrequency ablation of fibroids for the past like 3 years, and I've been out of residency for like 13 years. So it's not that these practices weren't around. Some of them are just gaining not only popularity, but the technology is improving. And so you learning about it is actually you guys being on the forefront of what your options are, but not every provider has done this procedure or knows how to do it. But we'll make sure that you guys have access to those who could and who do, including myself.
Great, thank you.
So how do you know if your symptoms are caused by uterine fibroids? Heavy bleeding, prolonged or painful periods. It's interrupting your quality of life. That does not necessarily mean that you have fibroids, but it could be the cause. Fibroids can be suspected during a pelvic exam. Sometimes I'll feel a mass, and that'll tell us like, oh, there's something there. We need to look at that. Again, sometimes you don't feel a mass because I told you the little ones can be just as problematic as the big ones depending on where they are. So the fibroid is not always enlarged, but what I am often one of my first line things when I have a person who has heavy bleeding or prolonged or painful periods is to get an ultrasound. I'm checking labs, I'm checking the blood counts, I'm checking thyroid, other like hormonal causes, but I'm checking for the structure of the uterus because just because I don't feel a mass doesn't mean there's not one there. Or if I do feel a mass, it doesn't mean it's a fibroid. It could be an ovarian mass or an ovarian cyst. So I think, one thing that you guys can do in the space of, advocating for yourselves is trying to get some sort of imaging. And typically ultrasound is first line for imaging of the pelvis, meaning the first kind of imaging modality we look for. Ultrasound typically gives us the best picture, looking at the types of tissues we're looking at in the uterus and in the pelvis. MRI can be helpful, CT scan can be helpful, but ultrasound is typically kind of the gold standard as a first look in the pelvis beyond just the pelvic exam. You can go to the next slide. Self-care is important. A lot of people will wait to seek treatment. I mean, is this picture, how many years these women waited before they sought treatment. Average wait time for women is 3.6 years, with 32% or more waiting 5 or more years. 79% of women say they don't want invasive surgery or long recovery times, and women want to preserve their uterus even if they don't want to have children. I think that the other thing that's sneaky about fibroids is that people normalize what they experience, right? So if you've always had heavy periods, well, then you've always had heavy periods. But what if it's just gradually getting heavier and heavier? You used to be able to change your pad or your tampon, every 3 hours. Well, now it's every 2 hours, or now it's every hour, or now it's every 30 minutes. Like, those gradual changes over the course of years can sneak up on people. And that's human nature. But sometimes it isn't important to take an inventory. Am I not able to, get up and go do something that I would like to do because I'm bleeding? Am I needing to change my clothes when I'm out and about? Am I in so much pain that I can't, or fatigued that I can't really do what I want to do? If your quality of life is interfered with, I think it is important to take that inventory and say, okay, maybe what I'm used to is getting beyond out of my control. Maybe this level that I was at before, even if it's only incrementally higher, is enough to seek treatment. So, again, self-care, advocate for yourself, even within yourself, to say, okay, it may be time for me to talk to somebody about these symptoms because they are changing my the way I move through the world. And your period, ideally, in my opinion, shouldn't change how you move through the world, in the broader sense. I mean, yes, you can carry your products, but ideally you would not be prohibited in doing things because of your period. And if you're in that situation, it's time to look into it. We can go to the next slide. So what are our fibroid treatment options? Let's talk about them. Well, you may have more choices than you think, so you should know what those choices are. Let's go to this next slide. All right, so everybody, a lot of people in that first video talked about birth control or hormone therapy. Birth control pills are not the only hormone therapy that are available for fibroids, but they are one of the options. It is because hormonal therapy can reduce the amount of kind of estrogen exposure to the fibroids, which can reduce blood loss due to them. It can reduce cramping. So that's the pill, but it could be an IUD, it could be a Lupron shot, it could be Orion or Oralisa, which are medications, or Myfembry, which are medications that turn down our hormones and reduce blood loss. The upside to those is they're really not invasive from a physical standpoint, but they can be invasive emotionally. They can be invasive, biochemically. So, not every option hormonally works for every person. Hysteroscopic myomectomy is an option for a person who has a fibroid inside of the cavity, those submucosal fibroids we talked about. And so myomectomy, remember, myoma is another word for fibroids. We're talking about removing a small fibroid that's in the cavity through the cervix. We take a camera, we look through the vagina, through the cervix, and take out the fibroid from the entry point of the cervix. Small fibroids, that's an option. One's in the wall, one's on the outside of the uterus, though that's not an option. They have to be small enough and in the cavity of the uterus for that to be an option. Uterine artery embolization, also known as UAE, or some people even call it uterine fibroid embolization, is where there are these occlusive, interventional radiology does this. Occlusive beads are put into the arteries that lead to the uterine arteries around the area where the fibroids are, ideally. And so it essentially cuts off the blood supply to the fibroids. So if there's not blood supply to the fibroids, there can't be as much excessive blood loss from the fibroids. And so that's typically something that we wouldn't do for somebody who still wants to have babies, or for somebody who has, certain contraindications. But it is an option, and it is a reasonably minimally invasive option because it's not big incision, surgery on the belly. Laparoscopic or open myomectomy is through the belly. Now we're taking out the fibroids rather than hysteroscopic, which is through the vagina, through the cervix. Now we're going through the abdomen, where we're either using a laparoscopic instruments, small instruments that we, make little incisions and go into the belly and take out fibroids that way. And robotic is another option. Laparoscopic and robotic kind of fall into a similar category. And then there's open myomectomy, where we actually make the bigger incision and go and take the fibroids out without the minimally invasive procedures. And then of course there's hysterectomy. We all know what that is. You go in and you take the uterus out. That can be done laparoscopically or robotically or open as well, depending on how big the fibroids are.
And we did have a question come through the chat, Dr. McDonald. So there's two here. The first is, are there any studies that show a connection between fibroids and having the Mirena, forgive me if I mispronounce that, over several years? And then she says the Mirena has been replaced as scheduled.
So long time ago, when I was actually in my residency, shouldn't say it's a long time ago, I'm dating myself, but I remember doing a journal club, which is where you basically look through literature and read about different articles and studies. And there was this one study that talked about IUDs, specifically progestin-containing IUDs like Mirena or Liletta or Kylena or Skyla. At the time, it was just Mirena, though, because the others were not around yet. Stabilizing fibroid growth. So not necessarily shrinking fibroids, but also not leading to their increase in size, but stabilizing them. And the thought behind that was that it was a progestin-rich environment as opposed to an estrogen-rich environment. And that progestin dominance actually helped to stave off fibroid growth or stop fibroid growth and to keep them stable. I have since had a really hard time finding that article and haven't seen any other real articles, like legitimate articles that speak for or against that theory. I personally have an IUD, a Liletta, which is Mirena's arch nemesis. They're the same though, essentially. And I'm on my second one, and I had fibroids back when I was having babies. And the smallest one now, because they shrunk after I had babies, that's one time that they do shrink sometimes, is after you deliver. That hasn't grown. So I feel like I'm also a case study that the fibroids, can stabilize with IUDs, but I'm still waiting to kind of put my hands back on that study. What was the second part of that question?
She just made the comment, the Mirena has been replaced as scheduled. Yeah.
Got it. Yeah.
And then we do have two more questions that came through. So the next one is, does taking creatine affect fibroids or hormones?
I don't know. And I'm the kind of provider that doesn't tell you something if I don't know the answer to it. Like, I'm not going to be like, maybe. Like, I honestly have no idea if there's a correlation between creatine and fibroid growth or shrinkage or what have you. I think that creatine, my understanding is it's good for muscle building and for, like in the setting of weight training and things like that. The type of tissue that fibroids are made of is not muscle. It's this fibrous, dense tissue that's actually, the uterus is muscle, but it's not muscle. The fibroids are not muscle. So I wouldn't think there would be a correlation, but I honestly don't know the answer to that question.
Great. And then last one here, can you have a laparoscopic procedure with several or large fibroids?
You can have a laparoscopic procedure with several fibroids, but there is typically a size limitation. Typically, most MIGS providers, minimally invasive gynecologic surgeons, which is a subspecialty of obstetrics and gynecology, most MIGS docs are not going to try to take out fibroids laparoscopically or robotically that are larger than 10 centimeters. You may find the occasional one who will push that limit, but often there's kind of a 10 centimeter cutoff to be able to remove the fibroids safely and to also be able to see around all the structures that need to be visualized. If the uterus is big and bulky and you can't get around it with your camera, then it becomes a less safe procedure. So you're not usually going to see a 20 centimeter fibroid being removed or 15 centimeter fibroid being removed laparoscopically, but a 5 or 3 or 8 and multiple 5s, or multiple 3s, it sometimes is an option. It does depend on the provider and what their comfort level is as well. And your previous surgeries, if you've already had like 2 C-sections and stuff, that's going to make it harder from a scar tissue perspective. If you've never had surgery in your abdomen, you may be able to get away with a little bit more minimally invasive procedural stuff.
Okay. And then one more just came in before we get to the next slide. Do hormones taken during egg freezing increase fibroid growth?
Another answer I don't actually have a definitive answer for, another question, I don't have a definitive answer for. I would think that they could, but also typically when you're egg freezing, egg vitrification is a procedure, a process that doesn't last more than a couple of months. Like you get one cycle in a month, and then you may get another cycle depending on how many eggs you want to freeze in another month. When I think about fibroid growth in response to hormones, I think of that over months to years. So even if you would have that hormonal exposure that could lead to some incremental fibroid growth, I would expect it to be minimal. The example that I think of is pregnancy, where I told you pregnancy often your fibroids will shrink at the end, but they often grow during. Not uncommon for a person to have a fibroid that can even get up to twice as big during pregnancy because of the hormonal surges that are taking place. But then once the pregnancy is over, everything kind of shrinks back down as the uterus involutes and goes back down to its pre-pregnancy size. You don't get that involution with egg freezing, but you would get only a small dose of the hormonal surges with egg freezing. So I would think that wouldn't be enough. I think about things like, would I tell you not to do it if you had fibroids? I wouldn't tell a person who has fibroids not to egg freeze, but probably wouldn't be bad to do a before and after scan, maybe 6 months between, just to see where we are.
Thank you. And we actually had another one come in. She said, I had an open myomectomy in 2018, but have since been diagnosed with hypothyroidism. Fibroids are back. Will balancing thyroids reduce fibroid growth?
It might, fibroids do seem to respond to a discoordination of hormones, whether that's an estrogen dominant space or just a lack of the normal cadence coordination of the menstrual flow. It seems like fibroids can respond poorly. And then weight, like if a person is hypothyroid, then I think about weight gain. And our adipose tissue, which is our fat cells, can also release a certain amount of estrogen that can feed fibroids. So I would think all would definitely be better once the thyroid balance is back in play, that you would have less of the hormonal lability that can contribute to fibroid growth, and hopefully a better just overall health status that would stabilize fibroid growth. I would expect so.
Great, thank you.
I guess we got into most of these, but just as quick review, hormonal therapy can temporarily, depending on the type, can temporarily, reduce the blood loss due to fibroids. The menopausal symptoms they're talking about are from like a Lupron or Myfembree or Orion, which kind of create an artificial menopause that's temporary to try to reduce blood loss due to fibroids. Once the medication is discontinued, the fibroids can definitely rebound in size, and bleeding can resume as well. But again, it's not surgical. Hysteroscopic is no incision, because it's going through the vagina, through the cervix. So most fibroids that are within the cavity of the uterus, if they're small enough, can be treated in that way. But fibroids can, I hate to say grow back. I actually try not to use that term fibroids grow back, because it's not that they grow back, it's new ones that grow. A person who has had fibroids can then grow new fibroids. And so the idea of, studies showing that 15% of people need a second procedure is probably because they develop new ones in those 5 years, but at least it's still minimally invasive. UAE requires one or more small incisions, usually either in the arm or in the groin. That's again done through interventional radiology, and it's an embolization procedure. Post-embolization syndrome can be like a pain, inflammatory response that comes from the cell death, essentially. Recovery is typically better than some of the more invasive procedures, but it is a significant reduction in, fibroid symptoms. 30% of people need some sort of additional treatment after 5 years, though. Laparoscopic myomectomy or open myomectomy is preserving the uterus too, because myomectomy just means taking the fibroids out, not taking the uterus out. New fibroids can grow. That's always a possibility, because you have to think of the uterus as almost like the soil of the garden. And so the fibroids are like weeds, you know, and I say that just as because I'm a person who likes analogies. So once you take those out, you know, you still have the uterus that can grow new ones. And so, you know, if you keep your uterus, then that's always a risk. But, you know, that doesn't mean that we shouldn't keep our uteruses. It just means that's a risk that we run or that we take. And then hysterectomy, you take out the whole garden at that point. And so no more, you know, no more fibroids, no more heavy bleeding, but risks that come with major surgery. I mean, there's general anesthesia involved. So there's that, you know, risk that comes with just kind of being in that state of being. And then the incisions, whether laparoscopic or open, it's still going to take a longer time to recover than the other minimally invasive procedures because you're basically, you know, having to recover even from the inside from disconnecting all of these components to the uterus because there's a lot of connections in there. So even if you don't have a big incision on your belly, you still have a lot of disconnections inside of the abdomen that would be that would require, you know, anywhere from 3 to 4 weeks up to 6 to 8 weeks of recovery. But again, once that's done, it's the definitive procedure, meaning there would be no more fibroids after that. Y'all hold on one second because my dog thinks that laying on my guest bed is okay. Fifey, come over here. Get down. He knows I can't come. He's like, why would I get down? Yes, thank you. You all want to say hi to my doggy? Say hi, Fifey.
Oh,
Hey, come here, come here. That's my boy. That's my boy. Okay, I'm done. I just had to get a check right quick. It's one of my kids.
So we didn't have a question come in, but somebody just commented, great analogy. It makes sense now that new ones grow.
I'm glad. I do like a good analogy because it helps you to understand what we're talking about.
Absolutely.
So what is Sonata? And you know, no secret, because even as we started this video, this webinar, Sonata is a newer and more innovative treatment for fibroids that gives us just one more option, one more tool in our tool belt than we had before. So it's an incisionless procedure, preserves the uterus. We don't have to actually remove any tissue, not the fibroids or the uterus itself. It does not require general anesthesia. It can be under what we call MAC anesthesia, which is sedation, like you go to sleep, similar to a colonoscopy or hysteroscopy, the scope part. Doesn't require overnight stay and works very well. So this is a video that kind of shows it. I'm going to talk over it, but I want you to see how Sonata works. So essentially, it is a procedure that's done, again, under sedation, similar setup as if you were getting a PAP. We get these Bovie pads on the arm legs for the conduction of energy. And we place inside of the uterus, essentially an ultrasound device. This is essentially an intrauterine ultrasound device that allows us to visualize fibroids from the inside. Then I can snuggle up next to the fibroid using this device, and I actually can insert these essentially like electrical conducting tines, which are able to pierce the fibroid. And then I'm able to kind of like, you know, make sure I'm in the right place. There's a lot of technical electrophysiology involved with this. And then I'm able to heat up this fibroid to the point of cell destruction. So fibroids that are in the cavity of the uterus and even some fibroids that are in the wall of the uterus are able to be treated in this way. So again, not removing them, but ablating them, killing them essentially. Fibroids, I told you, they're not muscle, they're fibrous tissue, but they have blood supply and they are essentially alive and they're able to grow. Well, if I'm able to heat them up to cell destruction, then they can no longer grow. They are at that point inactivated. And then what they'll do is, one, stop bleeding as much. They may not bleed at all after that, the ones that I'm able to treat. And then they also will shrink because you now have caused a cell death because of this heat that allows them to no longer flourish. And so they kind of shrivel up like back to my garden analogy, like a flower. You know, you get flowers and then you let them die on its table. just me. And so then they like, they shrivel down, and then next thing you know, they're not as robust, but they're still there. So the fibroids are still there, but over the course of some months, their activity is lessened, their size is lessened. So now your pressure is lessened, your bleeding is lessened, and it can just be extremely effective for the treatment of fibroids.
So we have a few questions here. There's a few different parts to it. So the first question, can submucosal fibroids be treated this way?
Yes. So if a fibroid is completely submucosal and pedunculated, so pedunculated fibroid is one that's like hanging on by a stalk in the uterus. That fibroid is probably going to be best served being taken out, being removed, because its blood supply is only based on the little neck of the fibroid. But other submucosal fibroids, again, back to my fruit, and say it's just kind of like impinging. Say this is the fibroid impinging on the uterine cavity. That submucosal fibroid can absolutely be treated. That tine can be placed in there. The electromagnetic conduction is able to be initiated, and that can be treated very effectively. And again, those are the fibroids that often are the ones that cause bleeding. So yes, size can matter. So ironically, a fibroid that is greater than like 3-4 centimeters is really hard to remove hysteroscopically, because you only have such big, the instruments are only so big to like shave them down in the cavity. 3 or 4 centimeters is like an apricot, like that. And fibroids can be like that in the cavity of the uterus, but it's hard to shave those down hysteroscopically. That's actually a really good fibroid for Sonata though, because we can ablate that size of a fibroid in the cavity a lot easier than probably removing it.
All right. And then how long after treatment can the uterus support a baby?
So not the studies are not completely done on that. There have been I think like the number, you guys correct me if I'm wrong, is like some hundreds of pregnancies reported after Sonata, but we don't have the full data yet. So it's not a contraindication. Pregnancy is not a contraindication for Sonata. Like if you wanted to do a Sonata, you can still be pregnant after. Different than I think what I told you guys with the ablation, like not ablation, the embolization. When we embolize the uterine arteries, we don't love people to be pregnant after that, because we have affected the blood supply to the uterus. It's not like you can't, but we actually say like, if you want more children or you want children, don't do an embolization. That's different with Sonata. Like we can do a Sonata, treat the fibroids, and then a person can be pregnant afterwards, but we don't have a lot of clear data as to like, timing, duration. I'm somebody who likes to give like at least 6 months from any kind of fibroid treatment and pregnancy, just for the uterus to heal in its entirety. But they're still collecting the information when it comes to being able to make actual statements as far as the fibroids are concerned, or as far as the procedure is concerned in pregnancy.
And then one other question, does the ultrasound only kill the fibroid and not healthy tissue?
Yes, so it only kills the fibroid. This is where the electrophysiology is involved, and I am, not the person who designed this machine, but there's this machine and there's another machine that has a similar method of action, where when you insert this probe essentially into the fibroid, you are able to calculate out how wide and how long you want that heat bubble or that heat ball to extend. And we do that and keep it within the fibroid, so that we know we are only treating the fibroid and not the healthy tissue around the uterus. It is very important for that to be effective, because that's also how we keep it safe. We can't be ablating, bowel that's close to the side of the uterus. We can't be ablating the bladder that's close to the uterus. We have to keep that heated ball within the fibroid. And that's all we want to treat anyway. That's all we care to treat is the fibroid. So it is important that it is contained and doesn't spread beyond. And the science is there to make sure that that's the case.
Great, thank you.
Okay, so the Sonata treatment is now available in the US and Europe. More than 8,200 women have been treated worldwide. That's pretty good. And 50 articles published in medical journals, including the Sonata as safe and effective treatment for symptomatic uterine fibroids. So that's, those numbers may not mean a whole lot to you guys, but it's a really solid patient population to be able to draw conclusions on, and the articles, you know, supporting its safety are why it's becoming more widespread and talked about, so that we can offer this as an option for more people. Let's talk about some numbers. So in the original trial, 147 women were treated and followed for 3 years. So 50% were back to normal activity the next day. 95% had a reduction in menstrual bleeding at 12 months. That's like almost everybody. And it doesn't take 12 months for them to get there. They start to see that immediately. But over the time, as the fibroids continue to shrink, that's how it gets better and better. 94% were satisfied with their treatment in 3 years. Again, better than, I think we talked about earlier, these some of these other management options, even hysteroscopy, even UAE, like 20 to 30% of people are needing something else, you know, soon. This is less than 10% who are, you know, feeling like they're not getting the effective treatment that they want. And 88% reported improved symptoms even at the 3-year mark.
Couple of questions in the chat. So can Sonata treatment be used to treat multiple fibroids?
Yes. Yes, as many as are safely accessible, yes. They can be treated with Acessa during the same procedure.
And then would this procedure be accepted by all medical insurances?
I don't know that. I know that there are some advances and improvements in coverage, but I don't know about all. I almost never say never, and I almost never say all. So I can't speak to that. I think a person's individual policy would need to be checked before I do any surgeries or procedures. We always do prior authorizations and pre-certifications of surgeries. We don't want anybody getting surprised, but I think that's worth talking to your individual insurance provider to see if this procedure is covered.
Dr. McDonald, I could just add, we are in network with United Healthcare, Blue Cross Blue Shield, Anthem, Cigna, and Aetna.
Amazing. That's very helpful. Thank you.
Thanks, Angela.
Alrighty. And then to learn more, you know, this is all the disclaimers and things that, of course, we wouldn't want to do this in a person who's pregnant or has an active infection or cancer, malignancy, any kind of intratubal implants. There used to be that way of sterilization that we put like these metal coils in the tubes. We rarely do that anymore, but you know, the presence of an IUD, unless we prior to the procedure, we remove it. And then of course there's like, you know, all the safety considerations that I would want a person to go over with their provider, with respect to fertility and the desire for pregnancy. Again, the safety and effectiveness have not been established. However, we are still collecting information, and I'm not seeing any indication for contraindication to pregnancy after this procedure this time. So if you want to learn more, you can visit Sonata, but you can also sonatatreatment.com. You can also, you know, if you're in the Chicagoland area and want to talk to me about it, I am accepting new patients and we can talk about it some more. But let's get to some of these questions.
Yes. Let's see here. So we do have one. She said, as I understand it, fibroids can still grow back even after the Sonata. And if this is the case, is there anything we can do to prevent more growth?
So, yes. So fibroids, the fibroids are fair game in the uterus, unfair game in the uterus from essentially young adulthood through menopause. A person's uterus is capable of creating growing fibroids all the way up until those hormones turn down, which is why some of the hormonal medications create and mimic an artificial menopause to stop them from growing or to make them shrink. So a fibroid that has been ablated or destroyed, like with the procedure Sonata, is not going to grow back, but new ones can grow. What can we do to stop that? Well, you know, that's the question of the ages. That one right there is the question of the ages. The things that we know about fibroids that contribute or that are correlated with fibroid growth have to do with lifestyle. So we know that when we have a diet that's predominantly or high in processed foods or ultra processed foods, fibroid growth seems to be higher. Obesity is correlated with increased fibroid growth. Low vitamin D is correlated with increased fibroid growth. So making sure your vitamin D levels are normal. But then you see people who, are vegan and exercise every day who still have fibroids. So that's why I say, the question of the ages is like, yes, we have some correlates to what can seem to be, related. Family history, ethnicity can all be correlated. But what can we really do to say, I don't want them anymore? Stop them. Let me do this so that I don't have them anymore. That's the part that we're not great at anymore, great at yet. I think the science is either lacking or the fibroids are just outsmarting us at this point. I don't know. I can't speak to it, but I will say this: living our healthiest life is probably the best thing that we can do. So exercising, diets rich in green leafy vegetables, can be correlated with reduced fibroid growth. So definitely doing the best that we can, but also knowing what our options are. And I'm not somebody who thinks that every fibroid needs to be removed, but I do think that fibroids need a level of surveillance. So if you know you have them, even if you're not having symptoms, keeping an eye on them every 3 years, even 1 to 2 years makes sense, because what you don't want is for a fibroid to grow out of hand. And the next thing you know, it's, 12 centimeters. And now you have to have a major surgery to take care of it, as opposed to it was on its way there. Maybe we could have, stopped it in its tracks.
Few other questions. So will IUDs have to be removed before any of the procedures that you discussed, including Sonata?
Yes. Minus like hormonal stuff. Like if you were going to do a myofibrosis or something, I guess you could do that with an IUD in place, but anything procedural, an IUD would have to come out.
All right. And then another question: fibroids typically shrink in or after menopause. However, they sometimes grow. In which case, is this Sonata treatment a good option, especially if there are multiple, or does it depend upon location of the fibroids?
Honestly, if your fibroids are growing after menopause, I'm wanting them bad boys out. I am not somebody who trusts fibroids that are growing when the hormonal support of them is gone or is being removed. So now I'm concerned, is there a malignancy involved? Is there something unsafe happening? Why are your fibroids growing when there's nothing there to feed them? Or shouldn't be anything there to feed them. So I would not Sonata a person who is postmenopausal, whose fibroids are growing. I would want those gone.
Thank you. And this isn't a question, just a comment. She said, wow, I had no idea low vitamin D was correlated.
Yeah. And so that doesn't mean go out there and eat, take all the vitamin D in the world, because you can't OD on vitamin D. Vitamin D is not a water soluble vitamin. It is a fat soluble vitamin, which means that it's one of the few that we can take too much of. A, D, E, and K are the four vitamins that you can actually take too excessive amounts, and it can be dangerous to you. So get your vitamin D levels checked is what that means. Go outside when you can. But if you are low in vitamin D, absolutely support that.
And then speaking of vitamin D, somebody asked, what's a normal level of vitamin D? And if low, what is the daily recommended intake?
I'm going to defer to my primary care colleagues on that one, because I think that the amount of vitamin D that's recommended to support low vitamin D depends on how low it is. And there are different nomograms within the lab parameters. I don't want to be like, oh, it's 25 milligrams per deciliter. That might not be true for your lab, but depending on how low it is, do you need 5,000, units per week? Do you need 10,000 units or do you need just a daily 600 or something? I don't know. I don't want to give you that kind of guidance, as much as I think it's worth having it checked, and then based on what your levels are, getting the guidance of your provider.
Thank you. Another question in the chat: do fibroids produce hormones?
Fibroids don't produce hormones, but they receive them, they respond to them. They don't make them, but they eat them. They eat them, essentially.
Thank you. All right, let me scroll back up here. We have a few more. Can fibroids be a contributor to high blood pressure in pregnancy and or even apart from pregnancy?
Not to my knowledge. I mean, fibroids are not, they do not, so high blood pressure typically has to do with the cell wall compliance of your blood vessels, just your blood vessels throughout your body. Fibroids are not, they don't modulate any of that. They bleed because they actually are like lead pipes that have blood vessels running through them. And while your muscles are supposed to be able, if your vessels are supposed to be able to contract and release in order to control how much blood you're losing, they're like frozen, you know, vessels throughout fibroids because it's like rock all around the vessels. And that's why they bleed so much, because there's not the control, because they're just like static, you know, when the vessels are running through them. That said, they shouldn't affect your blood pressure outside of where they are. So no, I'm gonna say with confidence, no.
Great, thank you. And then we just have a few comments. Somebody said, this is all great information. The visuals and analogies make me less intimidated by surgery.
I'm glad.
And then another comment, I had extremely low vitamin D once in the single digits, and I had to get prescription strength.
See, and so there's various types. I'm somebody in the Chicago gloomy months that I'll just take like a daily vitamin D gummy, right? Because you're not going to OD on a daily gummy. You know, it's like 600 units. It's nothing too substantial, but I know I'm not getting anything from being outside because the cloud cover just stays and makes us sad. So that's what I do in the winter months, but I think it really does depend on what your value is.
Definitely. And then just one more comment. This is absolutely wonderful information. I'm in Canada and waiting a year to see a gynecologist, and I'm still waiting.
Wow. Well, God bless you. And I do hope that this has been helpful to all of you guys. And you know, hopefully we can, you know, you'll have at least something to bring to the table when you go to your visit to say like, this is what I'm thinking, or what are my options, or even maybe be able to tailor who you see based on what they offer, you know, as their procedures.
Absolutely. And then somebody else said, this was very informative. I have lived with fibroids all of my adult life.
Well, I have them myself. Oh my goodness. I think my baby has fibroids too. She's got a big belly. This is my actual child who just came to see me. I thank you guys for joining. I am gonna have to sign off. Oh, there she is. It's my darling.
Yes. Thank you, ladies, so much for joining us this evening. And special thank you to Dr. McDonald for taking time out of your evening to educate these women about fibroids and their treatment options.
Thank you guys again. Have a great night.
Thank you.
I liked it.